Prostate Health Awareness Month, and for the man in your life, there are special steps to take to get a clean bill of health. If there is a diagnosis of prostate cancer, new technology can make dealing with it much easier and without the side effects of past treatments. Here to share the latest developments, please welcome the chairman of radiology from the University of Texas Medical Branch, Dr. Eric Walser.
Thank you, Dan.
Hi, let's start with what the prostate is, because, we always tell people, you should get it checked, and this is the age you should start doing this, and I find a lot of people still have no clue what it is, therefore getting a checkup doesn't seem so important.
Well, we better start with what the prostate is, shouldn't we?
Yeah.
Geographically, it's located at the base of the bladder, and its job is to take the sperm and mix with it various things to create the ejaculate, which is important, as we all know, in reproduction. It's small. It's maybe a little bit bigger than a golf ball, and as men age, it gets larger and larger, and unfortunately can develop cancers. It's one of the most common cancers in men, behind lung and colon cancer.
Interesting. You say it's one of the most common, but it seems like we've only started hearing about it over the last few years, at least publicly. Is that just because we're kind of taking it out of the closet, if you will?
Well, I think there's been a lot of controversy on prostate cancer recently, and one of the big tests, a screening test, is for prostate-specific antigen, also known as PSA, and I think a lot of the audience have heard of this. And what it does is it screens for prostate cancer. Well, it turns out the test is not very good, and it doesn't really, it picks up a lot of other things like infections and growth of the prostate that really don't involve cancer.
Yeah.
So what we're really interested in is just seeing the cancer. So we can't treat a prostate unless it's really got a cancer in it. So some of the newer technology now is making the prostate now open up to us so we can actually see it.
Yeah, and if there is a diagnosis, at least until relatively now, the treatment for it, oftentimes men would say, never mind, we'll just stop and kind of watch and see how it goes, only because they didn't like the side effects that could come with it.
Yeah, I think that you were seeing a lot of slamming doors from men walking away from their physician because the life-changing complications of prostate surgery are basically incontinence or leakage of urine and impotence or erectile dysfunction. Both of those things happen at a significant rate, up to 30% a year. So our treatment that we're looking at is involved in really sparing those men from these side effects.
A couple of things. One is you can pinpoint whether there's a cancer there easier, and the other thing is possibly treating it. So let's start with finding if there's a cancer present.
Yeah, absolutely. It's a two-pronged effort, and one of them is the new MRI machines that are very high field strength now and can actually see the tumors in the prostate down to about 3 or 4 millimeters in size.
Wow.
Okay, so that's number one. And number two is, well, once we see it, what should we do with it? And in the old days, the idea was just, well, take out the whole prostate gland. Okay, but
so
now,
the baby out with the bathwater.
Right. So now our philosophy is that if we can pinpoint these cancers and see them when they're very small, why don't we just treat them with a laser ablation?
Yeah.
And so that's what we're
looking at right here.
What you're looking at there is a blue and a yellow dot, and it's not a very great picture, but basically it's showing real time as a laser's destroying a tumor in the prostate. And as this is occurring, we're actually watching this on the screen.
Wow, that's amazing. And I would imagine, like, if you're removing a prostate, there's a recovery time, and it is a surgery and the whole bit. With something like this, downtime minimal?
Well, this one's great. We typically do them in the morning, and we let them go home about 3 or 4 in the afternoon.
Yeah.
So it's an outpatient procedure.
Yeah, and it's that ablation, so it's gone.
It's gone.
That's amazing, and that's a big difference in what we've been able to see over the past. Now, here's the other thing I think a lot of times as patients that we get confused on. We feel like if the technology is there, then and it makes sense that everybody's using it. Not necessarily. You got to find the right doctor and the right organization that has these tools.
With this type of technology, you're absolutely right. You have to have the right kind of MRI. You have to perform the MRIs in the right fashion to look at the prostate in the correct way. And you have to have somebody that's willing to treat these sorts of cancers focally, which is uncommon.
Yeah, and what patient qualifies for this?
This would be about 30% of men that have prostate cancer that have an MRI, like you see on the screen there, and there's one dark dot, and it's confined to the prostate. There's no metastatic disease. That can be treated fairly simply with a laser ablation procedure.
Yeah, and the point, again, that we oftentimes hear with any kind of cancer, and most illnesses, is early detection. Earlier we catch it, the better the chances are that you're done with it for good. Let's go through some of the kind of rules of engagement, if you will. What age should a man get the prostate checked, and what determines whether they should?
Well, I would tell you that the American Urologic Association just came out with some recent guidelines, and basically the PSA screening, which I was alluding to earlier, is really best for men in 55 to 69 years old. That seems to be the window where it has a great amount of efficacy. If you're less than 40 years old and you don't have specific risk factors, then you probably don't need the screening. And by risk factors, I mean generally African-American men or with a history of prostate cancer in their immediate family.
What are symptoms? And, of course, by the time you start presenting symptoms, as in many cases, it's been there a while.
Yeah, unfortunately, the symptoms of prostate cancer, once they appear, can generally indicate advanced disease like metastases to the bone and bone pain. And generally, it can block the outlet of the bladder, so it's difficult to urinate. But most men can have that anyway, just from aging and enlargement of the prostate, so it's not a very specific sign.
All right. If you would like to schedule an appointment with Dr. Walser or get more information on the prostate laser ablation treatment, log on to his website at utmbhealth.com/IR. Or you can call this number. It is 409-772-2000, 409-772-2000. And at any rate, just make sure that the man in your life gets checked. Thank you very much. But